let's look at factors affecting health in Nigeria. Factors affecting health in Nigeria. Of course, there are a lot of factors that will affect how healthy an individual will be or a community will be. Is that clear? So that's
Yes,
what
sir.
we want to look at now. So in Nigeria, there are a lot of factors that influence health outcomes. There are a lot of factors that influence health outcomes. We just pick some of the things. Let's look at those factors. And basically, all these factors, there are many of them. I want to categorize them into five categories. There are many of them. There are a lot of factors. So I wouldn't want to start listing them one after the other, but I will categorize them under five categories. Okay? So
Yes, sir.
these categories are social, social, that is social economic status. Let me just social and economic because they go together. Social economic status, education, environmental factors, cultural practices, and healthcare access. So let's start from the socio-economic status. So how how does socio-economic status of a person affect his or her health? What do you think? Share with me. What do you think?
Okay. Socio-economic factors. Okay. This it includes like the social amenities or the one.
I'm with you.
Okay. It also educational status, level of income, and employment. I think that's what I can tell now.
So how do they affect health outcome? How do the
It could be like
socio-economic factors?
ignorance or knowledge of health matters.
All right, let me help you. Now, if you look at the socio-economic status, now you find out that people with high income earners, those that are at high income levels,
Okay.
high income levels, there's this correlation between high income levels and the health, better health outcomes. On a general note, people with high income, people that earn higher, tends to do what? Have a better
To
health.
do.
Do you know why?
Yes, sir.
Do you know why?
Yes, sir.
What do you think should be the reason for the correlation?
Because they tend to take care of themselves than others because they could not take care of themselves, their health, because they are all expensive in Nigeria.
Yes, this correlation holds, provided that other factors are kept constant. Other factors are kept constant. Because you can still see someone that is rich and the person is ignorant, would die, will be falling
Okay,
sick.
yes.
Even with all the money the person has no knowledge that I can go to this place and take care of myself. So that this is possible if other factors are kept constant, but generally there is a correlation. Because people, let's assume someone that has the money, once you get the information that I can go to social place and they take care of myself. If the person goes with someone that doesn't have money to such place, the person that has money will pay for the services and get the treatment. But the person that doesn't have money will not be
Yes.
able to do it. True or false?
And do that. True, sir.
So if other factors kept constant, those that has more money tend to have access to more better what? They tend to have better what? Health what? Outcome. Is that clear? Is that clear?
Yes, sir.
And also, Not just about health outcome, not about going to hospital or for treatment, even on the aspect of nutrition, having access to, you know, buying, getting good food, good having, if it has to do with money anyway, having, getting good nutrition, good health care, even education, even proper education. In fact, those that have money can be in their house because they have money. They transfer thousands of naira to, even a consultant can even a consultant can even decide to go to their house to treat them. True
Yes.
or false? True or
Yes,
false?
sir. True.
Royal
True, sir.
doctors, royal doctors, or doctors that treat crazy. Do you think they are
Yes, sir.
ordinary medical officers? Some importance, and the millions of naira
Yes.
for them to leave their place and go to the house of the person to treat the. You know how much will leave the pocket. Is that clear?
Yes,
So
yes, we do that
economic,
often.
socio-economic is very important. By social now,
Yes, sir.
I brought in now royal now, royal, a king or a president.
Okay.
Social has come in, and two of us, because
Yes, sir.
he's a highly placed person in the society, right? Right. So doctors can go to their
Yes,
house,
sir.
nurses can go to their house to give them treatment. It's not true.
Yes. Sure, sir.
So now, you have been seeing how socio-economic status can influence what health. Now let's look at another factor: education. Education.
Okay.
So tell me, how do you think education has a do you think education has a link to health and better health outcome? If you think
Yes,
so,
it does because
let's share with me what you think.
okay, because in Nigeria now there are so many parents and about their children school fees. They just take them to any school. They've forgotten that there's the impact those school does. We have school of 200K and we have government school whereby with your 15K your children can start something.
Okay.
And at the end of the day, these children, these children in private sector do more, they do more than the ones in government school. In the sense that they inculcate so many things to these children like dramas, choreographies and different things. But in other school, which is the government school, nothing of such. And sometimes they won't give our children's they goes out for like children days parties and all that. But in government school, nothing of such.
So what business has this thing you said now? All this, what business do they have with health outcome?
Yes, they also okay, let me just share this sometimes the children in private sectors well they are properly managed and properly taken care of regarding their health. And sometimes they will even tell the children when you are sick, don't come to school. But in other private in the other government school, nothing of such.
Okay, okay, let's okay. Anyway, at least there's a point in what you say, because apart from that, said even some of these stop using private school, because it's if you say private school, it look as if it's all private schools.
Okay, it's not. No, it's not all.
And
The ones with properly
if you say government school, it look as if all the government schools are like that. Am
no
I
sir.
communicating? So don't
Yes
attack
sir.
private and government school like that. It's
Okay.
not all private schools are doing well. Not all government schools are doing badly. Is that clear?
Yeah.
It depends on the management
Yes
in
sir.
that. It depends on the management in that school. The management of the school matters a lot,
Yes.
whether it's private
Okay.
or government. What matters is the set of people managing that school. Some people are not serious. When you put people that are not serious, you will expect nonsense now. When people that are busy siphoning funds, government provides funds for all these schools. So when you put people that are not doing what they should do, then that is what you should expect. But if you put people that have integrity in the whether it's government or they will do well. So let us not attach it. Government school is not doing well. Now, what I can pick from what you said now is of when a student or pupil is sick, they can be allowed to go home or something. And apart from that, some of these good schools, these schools that we have a management team that still have their sense in their brain and have the good of people at heart. They provide even clinic in their schools. They
In the school.
hire doctor nurses in this and take
Yes.
care of the students in school. Yes, apart from this aspect, let's look at another area education can help. Here now, when we say education as a factor now, we focus more on health education. Education,
Okay.
anyway, education in general, because someone that is educated may be exposed, have chance to be exposed to the area of health, take care of themselves. Let's say, you can remember during that COVID-19 era,
Yes.
a lot of
Yes, sir.
people learned things that they were not doing before. Some learned how to wash their hands.
Yes.
Some learned, don't just wash your hands, put them under 2 minutes and under 1 minute and disappear. That you should cool down and wash your hands. I remember.
Yes. Yes.
I remember. Good.
Yes.
So these are okay now. Someone that is well educated in terms of take care of his or her, that I need to eat good food. I don't need to. This processed food I'm eating always is not good for me. Let me abstain from it. From if the person if person has no proper education in that line, the person will not be able to abstain from such things. True of us.
Yeah. Yes. Yes, sir.
The idea of going to the gym, doing physical exercise came from information, education that you need to take care of
Okay.
it. You need to exercise frequently. True of us.
True, sir.
Yes. Now, at the same time, the idea of now I don't need to really stress myself over this my relationship if I on time. I don't need to mind what my wife is doing. Let me remove my mind from what she's doing. Let me remove my mind from what my husband is doing. Let me remove my mind from what this my friend, my sister is doing to me before I have mental what illness.
Mental health. Yes.
Is from the knowledge, from education that education of mental health education, you know that you need to take care of the mental health. If the
Yes.
person have no such education, the person will be there quarreling, dragging issues. And from the person
Exactly.
may even develop high blood pressure. True of us.
Yes. Yes.
Have you now
Yes.
seen what education can do? Now, it's your health education that will help you to know that this water from this tank is not clean. This tank cannot be washed for a long time. And I need to be careful about how I put water and drink. I need to stop. I need to boil my water. It's education. A lot of people do take water, such water, out of ignorance. They don't know what is infection.
Yes. Yes.
It is also through education that I need to abstain from casual sex because I don't know what the person is carrying.
Yes.
It's educational.
Yes.
A
Yes.
lot of people are into a lot of people are down with HIV, are down with hepatitis B out of ignorance. They didn't know anything about it before. Have you now seen how education can help? in improving what health outcomes. So low level of education, they are linked to poor health. So if you're educated, it will help you to make an informed decision, an informed health decision, and it will help you to utilize health services effectively. Remember what I said about when we're discussing socioeconomic health, socioeconomic status. I said that someone may have money, but the person may not even know that I need to go to this private hospital to access health. You will see a billionaire, is because of ignorance, he's calling these people carrying concussion in head and walking in the street to come and give it to drink. This is someone that has millions and billions in his account. Because of ignorance, person is not exposed. You'll be taking all those things without even knowing what it contains. Have you not seen how education affects one's health? Hmm?
Yes, sir.
Now, let's go to the next factor. The next factor I want us to look at environmental factors. Environmental factors. So tell me, how do you think environment can affect our health outcome?
Okay. Our total surroundings as a woman has to be well equipped,
Okay.
like type of housing, water supply, environmental sanitation,
Okay.
method of waste disposal,
Okay.
industrialization. Then air and other pollution could affect our environmental factors.
Okay, I think there's a point in what you said. Yes. Your environment matters a lot. Okay, now let me paint a scenario. Let me paint a scenario. I have the knowledge of how to take care of my health, but because of my economic status, I find myself in area that is I'm managing to stay. And not just that the place is small, me, I am knowledgeable, but because of my financial status, I'm living in such locality, such place. And the place is filled with people with poor education.
Low, yeah,
And they have no idea of what keeping, what cleanliness, what hair, what that the sanitation of the particular environment can impact on their health. They don't know what it is. Now, because of that now, me that is because I'm staying in such environment, I am at risk
sure,
because some diseases may because of how dirty the environment is, some diseases may come in and it may be those that are highly that are communicable, that are contagious. There are those that are communicable through air, get it. What do I do? How do I control the air around me? How do I control the air
that's
around
a
me?
good question.
Even if I am a very clean man, will I be wearing nose mask all the time?
All the time.
So have you now seen how the environment can even affect you, no matter how clean you are? So when the total environment is in order, at least you are sure of our health. So that what I just described now is the area of sanitation. So how sanitized is the environment? If the environment is not clean, it's sorry, a lot of health issues. Mosquitoes will be multiplying in millions in the environment because of dump water, because of slumps around the place. And of course, you know what mosquito is. Mosquito is with spreading plasmodium from one person to another person. True or false? Because they need to feed.
Sure.
They need to eat to survive. Exactly. Now,
Yes, sir.
apart from the area of sanitation, there are other things that you can to manage it is another thing. Now, apart from the cleanness, the one you do by sweeping or cleaning environment, what of waste management? How is waste
Yes.
managed in
How do
Africa?
we dispose them?
How are they disposed?
Mm.
You walk on the street, in fact, you see people dumping refuse on the gutters.
Everywhere.
They will
Yes.
be blocking the drainage system. Tomorrow they will start blaming the government. And they will be
Yes.
going to the hospital spending money without even knowing where what they are suffering from come from. Is that clear? Housefly,
Yes, sir.
housefly will perch there and come and perch on food they are eating. And they're developing one disease or the other without knowing where it's coming from. What of the pollution? The generator we use, the lister we use, all these things go to the environment, go up to the environment, true of us, and pollute the air.
Yes, sir.
And pollute the air. And we'll be hearing it until we start developing lung issues, without even knowing respiratory problems, without even knowing where it's coming from. So the environment matters a lot. Is that clear? The
Yes, sir.
environment matters a lot. Now let's look at the cultural practices. Cultural practices. So tell me, how do you think cultural practices affect health?
Mm. Cultural factors, right?
Affects a lot.
Okay. It's going. Culture is a way of life.
Of course, I agree.
How do I put it? Of a group of people, and it's passed from one generation to the other.
I agree with you. So what link has it to do with health? What is the link?
Okay.
How can you link it to health?
It will be because of disease and what type of intervention people sought when they fall sick.
I want to see your face. I want to see your face.
Okay. Like in my environment, um, we tend to, I don't know how I'll put it.
Just tell me now. Just share with me. You must not get it correctly. Just share with me what you think. What I want, I want to see your face. Wait, just say, just what I want you to reason it out. You must not get it. It's not your fault. Just reason it out. That is the best way for us to start. Just reason it out. Let's discuss it. Then if you're not able, I'll explain. But I want you to reason it out. Just think about it. Don't tell me how do you think cultural practices can affect
Cultural. Okay. For example, in our cultural side, we met different people, and some of them they don't understand some certain illnesses, so we can put them through.
you know what?
Actually, we can put them through.
I'm listening.
I'm done, sir.
Okay. Now, there are some you know there are some people till today still do they still do this thing female genital mutilation.
Okay.
Are you aware?
Yes.
It's their culture. They find it difficult to stop it. It's their culture.
Yes, mommy.
And it's risky.
Okay.
You know the health implication.
Wow. Yes, yes, yes.
If they can contact disease through of us
Yes.
through that because they don't even, most times they use the same instrument to keep doing that same thing from the through of us.
Hmm.
Yes.
True, sir.
But do you think that will not affect their health?
Me too.
You know, when we say cultural practice, it's not only it can affect health positively, it can also affect health negatively altogether. It can affect
Yeah,
health
that was, sir.
positively, and it can also affect health negatively. Is that clear?
Yes,
So
sir.
when you on the negative aspect of it, something like this female gender mutilation can do that. Are you aware that there are some people that you don't subject. There are some culture that you don't subject them. They don't like anything invasive. Are you aware?
Yes, yes.
I've gathered such people before. They don't.
Hmm.
You don't do anything. Any invasive procedure on them.
Hmm.
What if the person is what the person actually needs at that point in time?
Good point.
The person may die, three of us,
True.
or the condition may get, the condition may worsen. It's not true.
Hmm. Yes.
And also, there are people that this one is has some it has a religious undertone because most times it's very difficult to separate culture from religion. The first culture
Yes.
they have this way of choosing with culture. So general belief there are people
Yes.
that they're not like blood transfusion. Are you aware?
Yes, yes. It happens.
So in that situation, if the person actually needs transfusion, what happens? The person may die.
Something that, yes. There are some cases like that.
Then also there are cultures that there are cultures that most of the food they eat are from their farm, natural things they eat. True of course.
True.
And they tend to be stronger.
Yes.
They tend to have longevity. They don't develop all these chronic diseases. There are people that some part of the world they are what they eat is what they eat is pure fruits, pure this organic foods. Are you aware?
Yes, yes.
That this organization, this are not actually taking over their ancient practices of eating the mother earth. We don't tend to develop these chronic illnesses.
That's all.
So, cultural practice can affect our health, either positive or negative. Are we together?
Yeah, that was,
Now, let's look at the next factor: healthcare access. Access to healthcare. Access to healthcare. How do you think access to healthcare can affect health outcome? How do you think access to healthcare affect health outcome?
yeah. Like a cheap from experience regarding that.
I'm listening.
Sometimes, yes, sometimes the patient comes to the hospital and because he or she does not have any relatives working. It's common among the government hospitals, which is the health centers. Health center is still properly managed, it's still maintained. But when it comes to federal hospitals or tertiary, they tend to the way they attend to their patients is quite different. I have seen the cases whereby the patient was rushed in, she was already going, and I was just calling someone, please quickly attend to this person. They started asking for card that they had to know some of this information. Just told the doctor then that why not just give a first aid, let this person get himself first before you start asking all these things. So before they could go and bring out card or anything, we lost this lady. So sometimes the access the patient gets is quietly um, low. That's one. Then two, if the patient is not down, like is not getting himself, they won't go to the hospital. That's ignorance.
Okay. Well, what you just described is one aspect of it. It's okay. Now, but I want you to understand something. When you said access to health, on a general note, on a general note, if someone may have money,
Yeah.
but due to be and know about healthcare, he's knowledgeable, he's
Okay.
exposed, but the person may still not have access to healthcare. Maybe because the government did not do what they're supposed to do. Government
Yes.
no good hospital around, even private sectors, no good hospital. They don't have equipment, they don't have personnel to take care of it. They don't have qualified healthcare personnel to take care of the healthcare of the people, to take care of the health of the people. And there's no access to good health. The three of us.
True,
There will
sir.
be no access to good health to the three of us.
True.
So you still be with your money and the people will die there because no qualified doctor, no qualified pharmacist that's to take care of the patient. No infrastructure. Maybe the person need oxygen, no oxygen in the hospital. And the person may even need urgently or urgently need
Oxygen.
they want to do some things in the maybe in
In the lab.
maybe even or even in the intensive care unit, no NEPA, no power.
Yeah. Yeah.
Before they run around to go and get diesel, they may lose the patient.
Yeah.
They will not still have infrastructure. Once you have inadequate infrastructure and even inadequate health personnel, it will affect service delivery. So it's not about knowing about health, it's not about money. What is on ground? What has the government or each or individual organization around it in the political environment put in place to be able to allow the people to have access to health care? It also affects our health. It also affects our health. Is that clear?
Yes, sir.
Do you have any question to ask? We end our lecture here. If you have any question to ask,
Nothing. What I just want to ask is that we talked about religion practice. So religion practice is under cultural, right?
yes, I actually culture and religion are not exactly the same thing, but most times you see them coexisting. They are difficult to separate.
Okay.
So that's why I just mentioned religion of the not I just mentioned the religious practices under it. Not that they are exactly the same, but they go together most times.
The next question is personal factor. Is it part of it, right?
I didn't get you.
As in, we have factors affecting it.
Okay.
We also have personal factors. Internal factors under environmental or social.
Which what factor is that?
As in personal factor, I think in the we have different kinds of factor affecting health.
Okay.
We have personal factor. I
Example.
think the personal factor is under environmental.
Example of personal factor.
Example, it's just like hereditary.
Keep your phone one place. I want to be seeing your face.
Okay, it's just like hereditary. Then, like I just want to know, is it under environmental
I don't
or
understand what you mean by personal factors. Give me an example of personal factors. Let me know what you mean by personal factors.
so you know we have different types of factors affecting health.
Yes.
I guess personal factors are money or not factors.
What do you mean by personal factor? Let me understand it first.
What affects us?
Example.
Okay, like hygiene.
Hygiene.
Yes.
Personal hygiene.
Personal hygiene, yes.
Okay, okay. So tell me now, where do you think it should be?
Okay. It could be under environmental.
Eh? See. You can find personal hygiene under socio-economic because somebody may you can find under socio-economic, you can find it even under education. But sometimes if somebody is not well educated, the person may not even know what personal hygiene is.
Yes.
True of us. True of us. Then also, then on the other socio-economic, somebody may not have money to be able to, get one or two things that will help him or her to keep that hygiene. There are people that don't even have money to even eat, let alone eating good food. So don't even have money to even buy soup. Are you aware? Are you aware that some people don't have money to buy pads, sanitary pads?
Sure. Very.
That's why you see a lot of NGOs now are sharing pads to people. You may stay in your house and say which one is pad again. That's talent of it. No, some don't have the money. It's like this small girl coming up. Some don't have the money to buy it. Some are using tissue. Some are using so when tear clothes and be using it. They don't have the money. So yes, personal hygiene is also a factor, but it can place depending on what. But in general, if somebody has good personal hygiene, the person is expected to be healthy. Is that clear? We can separate it and put it as a factor on its own. It's okay. It's okay. I like that. It can be a factor on its own, even though it has a link to all those ones. Yeah. Initially, because of the link it has, I didn't bother to go. But now that you mention it, I've mentioned it. I think it can be on its own personal factor like hygiene. And how do you take care of your health? Even your mental health, how do you take care of it? How do you take care of your mental health? It's also personal. Even self-care, you can say self-care. You can say self-care. Any other question? Eh?
For now.
All right, so we'll stop here for today. Hmm? Thank you very much.